Good morning. I'm Dr. Dana Hawkinson, the Medical Director of Infection Prevention and Control. And unfortunately, I'm in for Dr. Stites today, who, does have his full-time other job of having to treat patients as well. So he's got some clinical duties. But we are coming to you from the Dolph Simons Jr. Family Broadcast Studio on this wonderful Friday. And today is Follow-Up Friday. So with us, we have Amanda Cackler, who is the Director of Quality and Safety. She is in studio to help us answer questions. We'll also hear from the Royals, who are back at 100% capacity for fans in the stands. Senior Director of Ballpark Operations, Isaac Riffel, will tell us what to expect if headed to the games this weekend. And Janell Friesen, Public Information Officer for the United Government Public Health Department, is also waiting in the wings. She has details of a fun vaccination and testing event happening at the Speedway this weekend. Hint, if you've always wanted to drive around the track, now may be your chance. First, I have some numbers to update about our hospital in Hays. Hays does have 2 active infections and 1 in that recovery period. We here at the health system have 7 active infections, 2 in the ICU, but none on the ventilator. We also have 7 in that recovery period, so a total of 14. Overall, not bad. We know that our colleagues in Lawrence have 0. In hospital, so that is good as well. But I know people were wanting to go through some demographics, and Amanda was gracious enough to look at all of our patients that are in the hospital. We should note that the age range for all of our patients is quite broad.
Extremely.
14 months up to 88 years. Mm-hmm. And of those symptomatic patients, there are 4 who are in the hospital because of symptoms. Only 1 of those is fully vaccinated. We are continuing to see that people do have symptoms, but we are seeing that the majority of people that are coming in with symptoms are not vaccinated.
Yeah, I think that is absolutely correct. That typically whenever they're coming in asymptomatic, we've noticed that they've either been vaccinated or they're coming in with symptoms that have nothing at all to do with COVID-19. Yeah. I think this week compared to maybe last week or the week before, we were at a period where all of our patients who were here for COVID-19 were actually here for some other reason. And so today, when looking through our inpatient census and seeing that 4 of the 7 were symptomatic on admission, that's a little bit different. It's an extremely small volume of patients, but it's a little different than what we were seeing in the past couple of weeks.
But again, 4 of those symptomatic patients did not have any vaccination at all. So, again, we need to continue to promote and endorse vaccination. We know that's the way out of it. And that is the way to continue with full capacity at all of our venues, especially at the K. So let's welcome Isaac here. Thanks for taking a few minutes to tell us what to expect at the stadium from a fan perspective. So how is it being at 100% of fans in the stands? Do you know of people feeling safe?
Yeah, absolutely. It's very exciting to all of a sudden get back to kind of the normalcy. Fans, for the most part, have felt pretty safe. Mask use has gone down quite a bit. Now with the open order of, hey, if you're vaccinated, don't wear one. Otherwise, it's up to you. As they walk around, come in the stadium, kind of have no real close quarters or indoor area. Nobody's really wearing one. It's when they pop on the concourse every now and then someone will throw one on. And then staff's about probably close to 50-50, maybe a little bit less. Luckily, a lot of our staff were able to get vaccinated early and were able to open up.
So even though a majority of the stadium and where people are going to be are the outdoors, you're saying there's still, quite a bit less mask wearing in general now as compared to before, even in those crowded areas.
Absolutely. We were, even when the city went to where it wasn't mandatory, MLB was keeping mask wearing mandatory until this last homestand, basically. So whereas we were dealing with, they'd maybe wear it in and get to their seat and try to keep a drink or whatever in hand. Now it's been a lot more of only if they're standing in line or at a concession stand, or if they're going into an indoor space like eating inside the Crown Club or something like that, that we're actually seeing much mask use at all.
Yeah, and I think we saw from the professional sports organizations since last year that they were really pretty strict in developing really good protocols for keeping the players and everybody associated with the teams and the leagues safe, but also the fans. So I think that's good to hear. So what should fans expect? Are you back to normal even in the outfield?
Yeah, absolutely. The entire stadium now is back open, except for we've got two dugout suites, next to the field that currently are in the transition period of getting turned back into being used for fans. They've been used as kind of spread out dugouts so that players can spread out a little bit more. But now that more teams are getting more vaccinations, they've decided it was safe enough to go ahead and put them all back into the regular dugouts. So that is the only space that currently is not open for the rest of the area. The cleaning protocols for the outfield experience are all of a sudden a lot more intense than what they were. Lysol wipes are available throughout the entire stadium. Hand sanitizer all over the place. We're definitely doing our best to make sure that there's nothing the fan needs to look very far for to be able to get the place clean and feel better about using equipment, wiping down equipment after each use, everything like that.
Yeah, I think that's important, and we've always said, it's probably less of a chance of getting it, especially in the outdoor environment, from those inanimate objects, but we would always encourage, even if you don't have those wipes, encourage that hand hygiene.
Yeah, completely agree.
And so also, we know the Royals have been helpful in encouraging folks to get vaccinated, which is a great thing. Slugger also made a recent appearance at a vaccine clinic, which we will see at the end of the update, so stay tuned for that. Do you know if there are plans for the MLB to encourage fans getting vaccinated as well?
Absolutely. MLB's kind of working with all the teams right now, hoping to put out a press release soon, figuring out best way that we know that getting vaccinated is not only good practice, but it's going to be good for the sport. So we're trying to work on exactly what the best route will be that we're able to reward the fan for making the choice, not only good for their health, but maybe good financially, whether it's a ticket discount or being able to sign up for a raffle or anything on that. Just trying to do our best to make sure that, hey, we've hit that threshold of people who are wanting vaccinated. Now let's see if we can give the people who are maybe on the fence a little bit extra incentive to go and get it done.
Sounds all great, and continue to endorse that. We know, again, this is a way that we can stay at the K and stay at full capacity. So, well, thank you very much. Now, Janell Friesen with the United Government, thank you for joining us today. And we know that the mayor was on earlier this week talking about the incentives the United Government was planning to help increase vaccination and testing. This weekend, there's also an event at the Speedway called Race to End COVID. What is the opportunity, and how did this idea come about?
That's right. Thank you. So we're excited about the Race to End COVID event. It's going to be happening tonight and tomorrow. So basically, people can come out to the Kansas Speedway, and if they come to get either a COVID vaccine or a COVID test, they can actually do 2 laps around the track in their car. And again, that's going to be tonight, 5 to 8 p.m. and tomorrow, 11 a.m. to 4 p.m. And so anybody who's eligible, so of course you've got to have your driver's license and your registration and insurance, that sort of thing. But you can do those loops around the track. Anybody who's eligible and shows up gets to do that. But in addition to that, there are opportunities for raffles, for additional prizes for folks who get tested or vaccinated or both. And this is happening as a partnership between several different agencies making this happen. So there's, of course, NASCAR and the Kansas Speedway, the Kansas Department of Health and Environment, the Kansas Department of Emergency Management. There's us, the Unified Government Public Health Department, and then, of course, the University of Kansas Health System.
Yeah. I may go there just to get a third dose, just so I can drive the minivan around.
The minivan, yeah.
So, what should people expect once they do arrive at the track to get that vaccine or even take a COVID-19 test?
Sure. Some people have wondered about registration. You don't have to pre-register for it ahead of time. But again, make sure, you have your driver's license with you, your car registration, and your vehicle insurance. And if you are 16 or 17, you'll need to have a parent or guardian with you as well. And then you can also, if you have some passengers in the car, maybe you have a few other people with you, we ask that they're all there to either get that vaccine or that test. There are two different types of vaccine available. There's the Pfizer vaccine and the Johnson & Johnson vaccine. So the Pfizer vaccine is authorized for ages 12 and up. So that's a great option if you've got anybody who is under 18 who is in your vehicle. And then just keep in mind that it's a 2-dose vaccine. So you'll need to find another location for that second dose. There's not going to be another thing at the Speedway for that second dose, but there are a lot of places that will offer that. So there are many options to get dose 2. And then of course the Johnson & Johnson vaccine, which is for 18 and older, and that's just 1 dose. So 1 and done, which is really nice. A great option if you don't want to have to worry about that second dose. And then there are saliva tests. So you can get that test. It doesn't involve a swab. It's, quick and comfortable for your test. And then for people who afterward, you get entered into those raffles I mentioned. There are prizes like tickets for upcoming NASCAR races or gift cards for the NASCAR racing experience ride along. So that's a great opportunity as well.
Yeah, well, thank you. And we know we certainly have plenty of vaccine doses available too, where you can come get that second dose as well. So we know some states have lagged behind other states as far as vaccination goes. We know that within those states, counties, there's quite a discrepancy between counties as well. So we know that Wyandotte County has lagged behind some of the other neighboring counties in getting their residents vaccinated. What do you hope to see at this event?
Yeah, it's true that our numbers are still behind a lot of neighboring counties and a lot of counties in the states. We have certainly made progress over the past few months, but we're not where we need to be with that. So we really hope an event like this is something that's a fun opportunity, maybe for somebody who has been on the fence about getting vaccinated, or they're like, maybe I'll get vaccinated sometime, but doesn't seem urgent. Why do I do it right now? Well, there's this really exciting event, this really great opportunity tied to the vaccine. So hopefully that will, encourage somebody to come out and get vaccinated. And it's more than just getting a vaccine. You get this whole experience out of it as well. And we're also looking at other ways to, get creative. I think we're hearing about that in a lot of places of trying to find other ways to provide vaccines that help incentivize it, help make it something that's more interesting, more fun. And we hope that folks will turn out who might not have turned out otherwise if it was purely about vaccines and there wasn't this event with it as well.
And this is for Wyandotte County residents and non-residents as well?
Yeah, you do not have to live in Wyandotte County to go to the event. So it's open to people from anywhere can head out to the Speedway. So of course, if you're in the metro area and you're on the Missouri side, or you can just drive in from anywhere in the surrounding region.
Okay, and we have 2 questions for you. First of all, so where should people go to learn more about tomorrow's event?
Sure, go to kansasspeedway.com/race-to-end-COVID.
And Janell, we have a media question from Channel 9's Donna Pittman. She wants to know, are folks able to choose which shot they get at the Speedway?
Yes, you can choose between the 2 shots that are available.
And then Stephanie, I think you've kind of cleared it up, but she wants to know, do you have to be a resident of Kansas? Can you live in Missouri or anywhere?
You do not have to be a resident of Kansas to participate in the event.
And, this is speculation, but I think now, since there is such a large supply anywhere in the nation, if you're traveling on vacation anywhere, I think you can probably just walk into most either health systems, clinics, or those private pharmacies as well. So continue to think about that and really contemplate about getting vaccinated if you haven't. It's going to be the best thing for those around you and for your community. So, all right. Well, thank you to both of our guests right now. Before we jump into further discussions, though, are there any other reporter questions? No. All right. Let's get to our questions, Jill.
Okay, so before we get to the printed ones. We've got 3 from the community this morning that I think are worth kind of visiting about. Kathy wants to know, first of all, if you could clarify, you said that the majority of patients with COVID in the hospital were not vaccinated, yet a couple of the patients in the hospital with COVID were vaccinated. Please clear this up. Can fully vaccinated people end up in the hospital?
Yes.
Sick.
Yes.
So right now we have 7 inpatients who are in that active infection phase. 6 of them are eligible for vaccination just based on their age. Only 1 of them has been fully vaccinated, and this particular individual has some pretty significant medical conditions as an underlying at their baseline, and has been in the intensive care setting for, I want to say at least a week and a half, not on a ventilator, but critically ill, and was admitted with worsening COVID symptoms. But again, had significant other medical conditions associated with that. So then the other 3 or 4 that came in with COVID symptoms were not vaccinated and didn't have even a first dose of vaccination. So to answer the question, can you still get ill with being fully vaccinated? The likelihood is significantly lower if you're vaccinated to have that severe illness, require hospitalization, or even result in death. And we have seen that. That's been our experience here since it's become widely available in the public, is that typically our vaccinated patients are not symptomatic. But can it happen?
Yeah.
Yes.
Yeah, but again, as Amanda said, it significantly reduces your risk of having any symptoms. The whole spectrum of disease of COVID-19 is reduced with vaccination, but especially hospitalization, severe disease, and death.
Okay, Holly wants to know, what are your thoughts about myocarditis in teens with the vaccine? My 12-year-old has had 1 dose of vaccine. My 15-year-old is getting his scheduled time to get the first dose this morning. She's worried. What would you say to her?
Yeah.
As far as the vaccine causing the myocarditis, because we also know that COVID can cause the myocarditis.
So, we do know that your risk of having that inflammation in the heart is probably much greater with COVID-19, the actual disease. There are those cases that have been associated with the vaccine since the teens have been getting vaccinated. But is there a true association? There is a correlation. It's still being investigated, but those events continue to be rare. I would still recommend that you get your teenagers, anybody 12 and above, get them vaccinated. I know my children will be coming up for their second dose here fairly soon. They are going to be getting their second dose. I think overall it's going to be much better for them individually and, again, for you as a family. I think the risk of that is very, very low, and I don't believe that we've seen any real adverse outcomes from that diagnosis. But overall, that continues to be investigated right now.
Okay, and then, trying to multitask. So then the next question that we want to have before we go to our graphic questions, Betsy says, is the pandemic considered over? I have family members who say it's over. My 87-year-old mother-in-law is wanting to fly back in a couple of months from California because she says pandemic's over. I'm nervous because I have Addison's disease and she'll be staying with us immediately after flying.
Yeah, so I think the simple answer to the question is no, the pandemic is not over. We're still seeing very wide community onset. We see that throughout our state, neighboring states, and then also throughout internationally. It's still very, very real.
Yeah, I think that, again, we need to continue to move forward in our community and in the United States with grace and understand how fortunate we are. If you're talking to people really in many, many countries in Africa, if you're talking to people in India, Brazil, a lot of South American countries as well, the pandemic is not over for them. They are continuing to have hospital capacity issues, no matter how you want to look at it, actually. Even for us in the United States, we see it on an economic basis. We see the prices rising. We see shortages of things like microchips and lumber prices increasing, workforce shortages. So the pandemic is not over. We are very fortunate right here in that the number of our hospitalizations and our infections in the United States, and again, in our local community, is very low compared to what it is, but it is not over, and that's why we have to continue to stress taking those non-pharmaceutical interventions when we can, the masking, the distancing, but also especially the vaccination, because the vaccination is what is going to keep us safe and keep us moving along and the economy open.
All right, let's go to our first question that is left over from the week.
Yeah.
What do I say to my boss who refuses to get vaccinated or wear a mask? I'm vaccinated but feel uncomfortable getting within 6 feet of him. Our workplace has said it's okay to unmask if vaccinated, but no one is enforcing or checking on people.
Yeah, so I think this is something that many folks are going to struggle with,
Yep.
and I think there's going to be a personal decision that you're going to have to make, and make it based off of what makes you more comfortable. If you're vaccinated, we know that it is safe for you to be unmasked around other people, whether they're vaccinated or not. However, we've gone through now 16 months or so of being in a mask, which could potentially be bringing you some degree of comfort. So if it's that you don't feel comfortable getting within 6 feet of him, there's nothing harmful for you to put a mask back on or to not get within 6 feet of that person or any other individual. Going into a public setting, you're likely going to be around folks who are unvaccinated as well, or you don't know their vaccine status. So my recommendation would probably be, to the degree that you have that relationship where you can speak frankly with that person,
Yep.
you can certainly try to have an open dialogue with them. However, this far along in the game, folks who don't want to get vaccinated, who are not going to mask, I don't know what the success rate is of trying to convince them just through conversation. If it really comes down to it brings you some degree of anxiety, throw a mask on whenever you're engaging with those individuals.
Yeah, I agree. I think at this point it's just a matter of someone being obstinate. You know, there are no mandates and restrictions anymore. You really, as Amanda said, have to take those risks, weigh the risks and the benefits, just understand the environment that you're in. Certainly, unless if it's your boss, it is a much more touchy subject and more difficult to talk about. But unless there are other guidance or rules in your workplace, it's really going to be hard to kind of change that at this point.
All right. What is the number one reason people are telling you they don't want to be vaccinated?
I actually don't come across this very often. When I have had folks tell me that they are not interested in getting vaccinated, typically it is because they've already had COVID-19. So they're like, I already have some degree of immunity, and no matter how many times you tell them the vaccine can actually bolster that immunity and actually keep you even more safe, they're choosing not to vaccinate at this point. So that's typically the reason that I hear from people.
Yeah, I mean, we still hear the same things. It's new. I don't want to be a guinea pig. You know, again, those reasons continue to diminish on a daily basis. We do understand that compared to other drugs or other vaccines that have come to market, just the trials alone enrolled more people than probably 10 or 15 other drugs or vaccines have in their path to getting approved. We know that now there's been over 1 billion doses of vaccines given. They are safe. They are effective at preventing disease. But, you know, it just runs the gambit. There are just people who just don't want vaccines in general to, like you said, I've had COVID, or they don't want to be, quote unquote, guinea pigs, for which that is not true at all. So it runs the gambit.
And you kind of dipped into this next question, but it says, if I had COVID-19 last November, do I have natural immunity? What would the vaccine do, or how would it help benefit me? I also heard on the news this morning on the way in that there's a study that shows it is you're not maybe going to get it a second time as easily.
Yeah.
They
Yeah.
looked at like
And
lot
I
of
don't
people.
know what you're referring to, but what we do know is that the vaccine will absolutely provide you with better immunity than just the natural immunity. And back in November, before we were really maybe learning about the variants that we are aware of today, we know that those vaccines can also protect you against the variants that exist. So I think is the question, should I go out and get a vaccine even though I've had COVID-19? The answer to that is absolutely. It will help be more immune to the COVID-19 that's roaming around.
Yeah, to piggyback on that, you know, I think that study, I haven't had time to read it, just read the news blurb about it. I think it was a nursing home study out of England. And in the article it said prevents infection. That's not true. You know, you can still get infected, but the immunity that you get from either vaccination or natural infection will reduce those spectrum of symptoms. And what they found, I think it was at 8 or 9 months, maybe it was 10, you still had less chance. And, you know, that is consistent, again, with what the CDC has said. Reinfection is probably rare after natural immunity. or natural infection. More than likely, if you've had more severe disease or symptoms, you probably have a little bit more robust immunity. But I think still that immunity is not as great as if you had the vaccination, especially if you got infected with COVID-19 before, say, January 1st, when the variants, before all these other variants were circulating. So your natural immunity probably is not as good as with the vaccination.
Our next question is a masking question, and I'm going to throw in something that Pamela is asking. The question is, I'm vaccinated, but our young children are not. Should we mask in solidarity? And Pamela is asking, to add to that, I've heard lots of people say the mask doesn't keep you from getting the virus. It only keeps you from spreading it. Can you clarify?
So I think should you wear masks in solidarity is really going to be a personal decision for you and your family. I think, again, I am extremely pro-mask, so I think, again, if you're vaccinated, the likelihood of you transmitting or getting the disease and being severely ill is limited. It's not zero. It's not perfect. So there is a chance that you could potentially transmit onto your children or others, although it is significantly reduced when you are vaccinated. The other question around masking, in the very beginning, we were not considering that barrier protective from you getting it. It was really to protect others around you. But throughout the duration of the pandemic, I think we have learned that it can actually protect you from those particles getting into your mucous membranes.
Yeah, completely agree. Because not everybody was using surgical masks that are available in the hospital or in the healthcare setting. So the initial goal of that mask, whether it was a cotton mask or surgical mask or even N95, was to provide a barrier. But we also learned, as our knowledge evolved, that you do get a benefit from wearing it, and it does help protect those droplets and those aerosols from getting into your respiratory tract. So there was that added benefit, but the initial goal was to help reduce your ability to express it into the environment.
All right, we're starting to hike more as a family. I'm worried about ticks and other insects.
Yeah.
First of all, can they spread COVID-19? And I also heard that Lyme disease is bad this year. Is that true?
So COVID-19 is not going to be spread by any vectors such as ticks or mosquitoes. What you do need to do is wear long clothes, light clothes, so that you can see if ticks are on you, and especially use insect repellent, especially with DEET in it as well. There are a couple other compounds that you can use, but usually anything you're going to buy at Target or the hardware store or the outdoor store, it's going to be fine to use. So use that to protect yourself against ticks and mosquitoes. Lyme disease, typically we haven't had a lot of Lyme here around our area. We know that we do have the ticks in the area. There have been recent studies now that do show that the prevalence of that bacteria that causes Lyme disease is increasing in the Kansas and Missouri area, but we have other diseases that affect people much more commonly, such as ehrlichiosis, which is another bacteria that is spread by ticks, Rocky Mountain spotted fever, which is also spread by ticks. We have other viruses, such as Heartland virus and Bourbon virus, again, spread by ticks, not mosquitoes. But it is good to note also that a lot of the symptoms are the same for these diseases. So you could sometimes get a rash, you feel bad, headache, muscle aches, kind of feel like you have the flu. But the good thing about that is these bacteria that cause Lyme disease, ehrlichiosis, and Rocky Mountain spotted fever are all treated by the same drug. And it's a very generic and simple drug that has been around a long time and high efficacy rates, and that is doxycycline. So again, what I would encourage is just really prevention, and that is wearing long clothes and wearing a good amount of insect repellent as well.
And I really appreciate this question because it's talking about outdoor activities really as we're approaching today I think it's supposed to be in the high 80s. And really thinking through other prevention mechanisms other than just prevention from COVID-19, but the other illnesses that exist out there. And obviously, if you're out in the sun, prevention with sunscreen.
Yeah.
My daughter-in-law is pregnant. Her doctor has said the end of the second trimester is the perfect time to get the vaccine. If true, why is that the perfect time?
Yeah, you gave us a heads up with this one, so we were able to consult with some of our experts here. And I think the response was the perfect time to get a vaccine is any time you can get the vaccine. There wasn't really any significant reason to wait until the end of that second trimester. So I think the recommendation from here, if I understood correctly, was just don't delay getting that vaccine.
Yeah, don't delay, and when you can get it, especially if it's earlier, like in that second trimester as opposed to the third trimester, you, as mom, is going to be able to mount that antibody response and then, transfer those antibodies to baby to give baby protection as well. So anytime is the perfect time.
All right, when talking herd immunity, are you counting just those people vaccinated, or does it include people who have had COVID-19? If natural immunity is not as strong as a vaccine, will we truly reach herd immunity?
Yeah, I think this is a very good question. We've tried to address that a little bit. So first of all, for herd or population immunity, we need to include the whole population. So a real issue I've had is that there's only a certain subsegment of the population that is able to get vaccinated. That's 12 and above, and before that it was 16 and above. So you are cutting out a whole subsegment of the population based on the age there. So you are not going to reach herd immunity like that. And again, there has been vaccination, and just understand that it is a kind of gray area. So, but we have included some aspect of the natural immunity from COVID-19, if you've had it, into that group that we are saying this will contribute to that herd or population immunity. But until we have, say every child who is 6 months and older, just as for influenza vaccination, or even 2 years and older, available for vaccination, and we start to vaccinate that group and all those ages, that is when we are truly going to be reaching herd immunity. Right now, we are doing the best we can just because children who are 12 and above can get vaccinated. So we hope that everybody who is 12 and above can get vaccinated. So that was a lengthy answer, but that has been a site of contention for the general public of, well, what is herd immunity? First I heard 80 or 90%, and then down to 75. But it's really just about thinking about the concept of who are the people that are eligible or can get the infection and spread the disease. So by getting vaccination or even some of that natural immunity, you are reducing that risk of somebody getting it and having the ability to spread it as well.
And before we go to the next question, Isaac, who always watches, we appreciate him so much. He wanted to know if you knew about the volunteer in Seattle who got the very first trial dose of Moderna vaccine way back in March of 2020. Have you heard anything about him, how he's holding up, if his immunity is still there?
About the trial vaccine? No, they haven't published that. Maybe it's out there, but...
Well, we'll see if we can find that. Okay, next question. The COVID-19 vaccine gave me the most severe case of tinnitus ever, and I'm still struggling after more than 7 weeks. I can't imagine having COVID-19 could be worse than this. Will the tinnitus go away?
Mm-hmm.
So I obviously can't speak directly to this particular event. I did look into the frequency in which tinnitus is being associated with COVID-19 vaccination. And I think this is an example of, and maybe not in this particular case, but whenever we start hearing about individuals complaining about the symptoms or diseases that they've experienced, or not maybe diseases, but just those symptoms that they've experienced after the vaccine, that's why it's so important for us to have that event reporting system and really being able to look at the frequency in which these symptoms occur in the population for those just pre-vaccination and then post-vaccination. And what we know today is that there is not a statistically significant difference between general population and vaccinated population, suggesting that it's truly a result of the COVID-19 vaccine. This would be one where I would suggest that you work with your physician and talk through those symptoms and management, tracking it. I know that the tinnitus can occur regardless of COVID-19 vaccination, and that it is time sensitive in regards to the treatments that they would recommend.
Yep.
Okay, I read a story on CNN.com that explored reasons for vaccinated people to continue masking and distancing because it would significantly reduce infections and death. Did you see the study? Do you agree?
So I looked this up. I'm not positive that it's the exact same study, and I didn't actually get the source of the study. It was really just sort of the commentary from the folks that have maybe read the study. And it really comes back to what we've been saying along, that there are there's true benefit in the masking and the distancing, and we've seen that throughout the pandemic. And what I took away from the article was really the importance of continuing to get the vaccination until we can reach that herd immunity. Would it really be an indication that we could truly stop masking? And so I think it's important to emphasize that the CDC guidance today still continues to indicate that if you're not vaccinated, you should still be implementing masking, social distancing as a way to protect yourself and others.
Yeah, and I think I did see this study. This was a mathematical modeling study, and we know that our expert here for mathematical modeling is Dr. David Wild. However, I tried to read it. I didn't get through it. It was putting me to sleep. But what it did emphasize is certain proportions of the people that were vaccinated versus unvaccinated. And they just tied in a bunch of different numbers and parameters for that and looking at that. And basically, they just showed that if you can continue to make and have protections as much as possible, you are going to be able to reduce the spread. And that is those non-pharmaceutical interventions like masking and distancing, but also vaccination as well. Remember, there's no one golden, a magic bullet. There's no one panacea. It's a combination of things. And so continuing to do those things, especially as Amanda had talked about, you probably have to assume that not everybody who is out not masking is actually vaccinated. Continue to do those things to help continue to reduce infections.
Okay, and our last question today. What could be causing the huge spike of COVID-19 in Livingston County, Missouri? It was recently rated the second hottest spot in the United States.
Yeah. Well, I was kind of thinking about this, and I think this is what we're going to see moving forward, as I talked about early on in the update with, we know that some states are better than others at having vaccine coverage. We know that even within those states, there is a discrepancy between vaccine coverage in those counties as well, and we talked about Wyandotte County. I think is what we're looking at. We are going to continue to see those hotspots pop up probably around the country in different areas at different times, depending really now on vaccine coverage. So hopefully we need to continue to get everybody vaccinated. That is probably, not living there, not having a lot of information from there. I'm going to say that it's probably due to vaccine coverage.
And I think we'll learn more about this as these hot spots, I don't know if that's really the right term, are identified. This local and state health departments jump in, help with those investigations, and really help to mitigate the continued spread. So I imagine we will continue to learn a little bit more about the reasons for it and what they're going to put into place to reduce the spread there.
So this was before vaccination, but if you look at the rural Kansas counties when they got hit hard, it was because of either prisons or where people are really housed close together, or it's because of the food processing plants. If there's anything like that going on in those counties, that could have a severe impact. If you have multi-generational housing, that can have an impact as well. But I think it will boil down to what is your vaccination rate and how many of those people that are susceptible to the disease can still get it because they are not vaccinated. So I think we need to continue to promote vaccination for that reason. Yeah. Any other questions from the community?
We are good right now.
All right. So, in Monday, you may recall a lot of work being done earlier this spring by area schools to prep for proms and graduations, but then the CDC relaxed masking and distancing guidelines. Kenny Southwick, Executive Director, Cooperating School Districts of Greater Kansas City, is back to talk about what happened next. Plus, he peers into the future for summer sports and getting back to school in the fall. We'll also hear from students at Ruskin High School in the Hickman Mills School District on what they're thinking and feeling about the COVID-19 vaccine. Any final thoughts, Amanda?
Sounds like a really exciting opportunity if you need to get vaccinated to head out to the Speedway. That sounds really exciting. And if you're already vaccinated, enjoy some outdoor activities.
Yeah, and we're available here too if you're needing any first or second doses as well. Please contact the health system. It should be a nice weekend, so try to spend time outdoors as much as possible. And as we sign off for the weekend, be safe. Wear a mask if you're not vaccinated and out in public. And be like Slugger, who recently showed up at one of our vaccination clinics to get his shot. We'll see you Monday.